everyone. Welcome. Friends, community, special guests, we really appreciate you for being here. For everyone who stands for maternal health and families, today is a special occasion in our journey to transform maternal health in New York. I'm Myla, the Executive Director of the Birthing Place Foundation, and also the co-founder of Mariam Reproductive Health, Woombus, and as a birth worker of 18 years, a community organizer, perinatal educator in the Bronx and New York State advocate, I've witnessed firsthand the disparities of maternal health care, the statistics, the humans behind them, and our lack of access to quality care. And I've also seen resilience, hope, and the power of community. Somehow, through it all, community continues to show up. And it is such a blessing and a power and a privilege that we show up every day to this work, roll up our sleeves and get work done because we cannot wait for others to do it for us. The Birthing Place was born out of necessity and will continue to grow into hopefully eventually a birth center. But the theme is a vision. And we are working to revolutionize maternal health care and create culturally safe, responsive care to our communities and the families within this borough and beyond. Today, we take a significant step, and we welcome you all to be joining us here at Mariam Reproductive Health and Wellness. I acknowledge the remarkable individuals who have supported along the way. My co-founder, Dr. Carla Williams, an OBGYN who she herself just had a baby a couple weeks ago at home, and many other people who are part of our team, midwives who work in collaboration, perinatal professionals like lactation consultants, pelvic floor therapists, and massage therapists, the wraparound care that we desire to have. We are building a model here that we hope to sprout into a new location, because I want to be very specific. People have been congratulating, great, your birth center's open. No, this is a clinic. This is amazing. We are so happy to be providing this very step towards a birth center, but what we do sincerely want is to have a birth center here in the Bronx. And as president of the New York State Birth Center Association, I'm very well aware of my peers, some who are here today working to open birth centers in different boroughs and throughout our state, which lacks in maternal health services. GYN services are lacking in 20 counties in our state, and this is not okay. That's 1/3 of New York State counties. So I would love to just acknowledge as well the people like Bruce McIntyre for your commitment to maternal health, and that is driven by the memory of Amber Rose Isaacs and many other people who have sadly lost their lives as we have continued to press forward. And of course, I want to just express excitement for this new stage in our journey. We have the Birthing Place Foundation, which is supporting Conscious Birth Collective mentorship and doula training program. And we have 5 cohorts of birth doulas and birth professionals who have moved through this collaboration of many doula collectives that have come together to train the workforce. And we have a powerful initiative called Familia Flourish, which we hope families will come through here. Starting late spring on Wednesdays, we have a gathering of people feeding their babies, and we want to give them referrals. We have it's built with and in collaboration with a Black doctor of psychiatry, postpartum perinatal psychiatry, and we're like in collaboration with Doulas en Español, and really just wanting people to come through and receive the care. I could go on and on about the services, but you can also just look us up, and we are just grateful. And now I would love to introduce this remarkable woman who has dedicated such time, and the team at the Bronx Borough President's Office has been working with us 2 years now in the making. thankfully, they did the work of talking to so many individuals in the community, collaborators, various people working to open birth centers or who have not had much success and who have had closed birth centers, because that has been an issue as well. And so it is my honor to, first of all, I realize there's a whole run of show that I will introduce in between, yes. Or should I say their names now? Okay, well, it's Deputy Borough President Peguero, Jennifer Dorn, the Director of Midwifery at Morris Heights, Brittany Russell, yes, okay, great. And so now I'll hand it over to this wonderful person. And I really believe in the interest in creating community-driven solutions. And Vanessa Gibson has been there, really standing tall and proud and really uplifting those of us who are doing the work in the community. Thank you so much.
Thank you. Thank you.
Good morning, everyone. Buenos dias a todos. Bienvenidos. Welcome, welcome. I am so excited to be here, and I welcome each and every one of you to the Miriam Clinic. This is our reproductive health and wellness hub right here in the beautiful community of Norwood in the Northwest Bronx. I am Bronx Borough President Vanessa L. Gibson, and on behalf of my phenomenal A-team at Borough Hall, I want to thank all of you for being here for such an important reason as we call attention to addressing birth equity and birth justice in the great borough of the Bronx. Bronx mothers cannot and will not wait. Today represents a culmination of over 2 years that our office, in conjunction with the Birthing Center, with Myla Flores and the entire team and all of our birth workers, doulas, and midwives, our OBGYNs that represent Bronx County, we've been collaborating with them on the release of what we believe is an important documentation that recognizes the inequity that has continued to face Bronx women, birthing individuals in our borough that have not always had access and opportunity to healthcare equity, maternal health, and what I call maternal justice. Let me first acknowledge the amazing team at Borough Hall. While I may stand here as Bronx Borough President, I am so proud of the team that is assembled at Borough Hall that works so hard each and every day to work with stakeholders, to look at policies, to look at budgets, and how we can improve the health outcomes of our fellow residents. So standing at my side, she is a new mother, she is a proud wife, and she is the mother of a beautiful baby, baby P, Penelope. I want to acknowledge our Madam Deputy Borough President, Janet Peguero. She is here with baby P and her husband, Barfield, and together they are raising their beautiful daughter. I also want to acknowledge my Health and Human Services team led by our Deputy Director, Maknoor Jara, and Rafael Gomez, new addition to our team, my comms director, Michael Ivory, the policy team led by Eric Pessner, Jordan. I want to acknowledge Alondra Perez and everyone who has done tremendous work. I'm also joined by our director of the Community Boards Unit, a new mother as well. Her and her husband are raising their beautiful son, Ronan, and I want to recognize Kira Gannon, who's here with her baby as well. We have lots of babies being born at Borough Hall. And I'm just truly thankful to the staff. And again, I want to say thank you to Michael, Maknoor, Arlene, our press secretary, Eric, Alondra, Josh, Raphael. Thank you, thank you, thank you. We are here because we are talking about such a critical topic that affects the life and the well-being of so many of our mothers and women here in the Bronx. As the borough president, the deputy borough president and I are adamant and committed and intentional about this work. We are the only borough in the city of New York, 5 boroughs, that is led by 2 women of color. And so we take this work extremely personal when it comes to lifting up the voices of so many of our families in need. I take this moment to also acknowledge the trauma and the pain that this industry, unfortunately, systemic racism has caused in the lives of so many of our families. I think about the husbands and the partners that are now raising their children because of maternal mortality and morbidity. I think about Bruce McIntyre, who is here with us, who lost his beloved partner and queen, Amber Rose, and is now raising their child. I think about so many in this borough that have turned their pain into purpose and their storm into strength. I lift up those voices because I think it's important to acknowledge the trauma that is associated when you lose a loved one to pregnancy-related complications. And we know, and we have the graphs, we have the data, we have the statistics, and we know that Black women are 9.2 times more likely to die during childbirth because of pregnancy-related complications. And Latino women also. We know that this is an issue that affects our people. And so when we say this is a call to action and attention, it is. This is about saving lives. This work is about giving our mothers and women and children a fighting chance to live. So I need everyone to understand at this moment how important this work is. I hear stories all the time as borough president. The deputy borough president and I hear these stories. And so I want to amplify those voices of those that have been pained and wronged by this system. Today represents an opportunity to move our borough forward. It is not just about healthcare as a crisis, but it also demands our action and attention. The Bronx has been disproportionately impacted by high rates of maternal mortality and morbidity. And some often say, Ms. Gibson, why the Bronx? I hear that a lot, right? Ladies and gentlemen, why the Bronx? Why is it our women, our birthing individuals that are affected by what we're seeing in terms of these outcomes? We have to talk about the social determinants of health. We have to talk about health equity. We have to talk about prenatal and postnatal care. We have to talk about wraparound services and trauma-informed care. Yes, yes, and yes, all of that matters. We have to make sure that we lift up women that could be immigrants or undocumented or may not speak English as a primary language. We have to talk about the barriers like transportation and the cost of health care. Yes, it matters. And it has hindered our ability to achieve maternal health care outcomes that are reflective of our priorities and our values as a borough. And so on this day, as we call attention, we collectively say, Bronx mothers cannot wait. We are affirming our commitment. We are showcasing what we can do, the power of what we have. I am so grateful to everyone that has contributed so much to this work. Your leadership has been invaluable as we talk about the need, as we talk about the challenges, as we look at data, and we call action and attention. I want everyone to understand that a lot of work has been done. And so let me not take away from the work that has been done. I acknowledge our governor, Kathy Hochul. I acknowledge our New York City Council Speaker, Adrienne Adams, and the Women's Caucus, and so many of my sisters and colleagues that have done a tremendous amount of work, making sure that non-for-profits are given funding. But yes, it's great, but guess what? It's not enough. And so the reason why we are here, as we talk about Bronx mothers not being able to wait, we are really talking about what more we can do as a community, as a borough, as an administration. And so I take this moment to say thank you. Thank you for recognizing the important work that is happening each and every day. Central to today's report that we are officially releasing today is the urgent need for a Bronx-based birthing center, one that will offer patient-centered care, culturally competent care, driven by midwives, doulas, birth workers, healthcare providers, nurses, yes, who all understand and respect our community's unique healthcare needs. This birthing center will give Bronx mothers and birthing people options for how they receive care, options that reflect their unique experiences and the cultural competencies that are necessary to ensure healthy outcomes for both mom and babies. It will also address the critical maternity services across our borough, ensuring that more women have access to the care that they rightfully deserve. All of the doulas and midwives and health advocates that have been on the front line, I celebrate you, and I recognize this important work that you have embarked on throughout this journey. We thank you, and we honor you for your unwavering dedication to keeping our women safe. To each and every one of you, I say thank you. As we look to the future and with the release of this report, we must understand maternal health care policies, expanded funding for our CBOs, and a commitment to ensuring that every woman, no matter of her race, her religion, her background, her documentation, or her language, has access to the care that she and her family need. We're not talking just about mothers, ladies and gentlemen. We're talking about the lives of mothers and their families and their children, the babies that are born. Maternal health is a crisis, and it's a public health emergency that calls for us to act. And as we work together, we want to build a Bronx, a great borough where everyone can thrive. Every birthing person has the option to receive the care that is respectful, that is dignified, that is compassionate, and is culturally relevant. Because we come from many different places and spaces, but we all want the same things. Our goals are aligned, our priorities are aligned. So as we continue to push for the establishment of a Bronx Birthing Center, we want to ensure that every woman in our borough has a chance to give birth safely and with dignity. My deputy borough president, my community boards director, they were blessed because they were able to bring life in this world and not lose their life at the same time. And while I recognize so many of our babies that are born healthy, I also acknowledge that there are many outcomes that are not good. Right? And so as I celebrate this moment, I also take that moment to recognize that not all outcomes are always good. And so we have to honestly work on that and make sure that that continues to be relevant in these conversations. The birthing report is going to be live on our website, but for anyone, this is what it looks like. Delivering change, establishing a birthing center in the Bronx. This is a document that is reflective of our commitment. 2 years it took to put this report together, and I am so incredibly proud of the labor of love, the intensity, the challenges that we faced, but we persevered. We said we are not going to allow our women to die as they give birth. We're going to lift them up and celebrate them and let them know they are loved, they are appreciated, they are respected, and they are valued. Our women, our mothers. Yes, ladies and gentlemen, it matters. I am filled with so much emotion because I think about all of the other women that did not make it, and they look just like us. And so that's why this work is deeply personal. I want to acknowledge all of the partners who are here today, and you will hear from some of them, but let me acknowledge our founder of the Save a Rose Foundation, Bruce McIntyre, our filmmaker and fellow Bronxite. She released a film last year called You Are Not Alone, and I want to recognize Brittany Russell. I want to thank our Assistant Commissioner for the New York City Department of Health and Mental Hygiene, Anita Reyes. I want to recognize all of our doulas and liaisons and family wellness counselors. Gina Williams, our Deputy Advocate, on behalf of New York City Public Advocate Jamani Williams. I want to recognize Dr. Jennifer Dorn, our Directory of Midwifery and Childbearing, the center at Morris Heights. The Childbearing Center of Morris Heights was the first ever birthing center that opened in our borough back in 1988. And it lasted for quite a while, and then it closed for a number of reasons. We have not yet fulfilled our goal of reopening that birthing center. And that's what today's conversation is about. As we officially release this birthing report, it is with the understanding that we are going to put our money where our commitment is. And I am committing to all of you today. We are in the budget process right now for FY26. And I am committing that I will put capital dollars in my budget so that we can support the opening of a birthing center. I will do what is necessary to make sure that we save lives. So to everyone who has joined us, I also want to recognize our partners at the Bronx Health Link. They do a lot of work on Knot 62 with the Institute of Family Health. You all know we have some of the poorest health outcomes in the Bronx when it comes to asthma, heart disease, obesity, kidney disease, and renal failure, all attributed to our health outcomes. So you all understand that this work is correlated. We can't talk about access to health care and mental health services without talking about maternal health. It is a part of these conversations. And so for that, I am grateful. I also want to acknowledge this beautiful report was not done by my office. It was a collaboration. And so I do want to recognize our designer of this beautiful report, BD Feliz. Where is he? He's here somewhere. Yes, thank you. Thank you for designing this report because Bronx mothers cannot wait. So ladies and gentlemen, as I turn today's press conference back over to Myla Flores and say thank you so much for everything, I just want again to reiterate the point of why we are here in the first place. There has been a system in this society that has been set against us, women and women of color. And I feel that when you attack one of us, you attack all of us. And so we are united, we are standing in solidarity, and we are going to affirm our commitment to all Bronx women. Bronx mothers matter. Bronx babies matter. Right. And as we do this work, we're going to set families up for success and not failure. We're going to remind them that no matter where you live in the Bronx, you deserve access to maternal health care. You deserve access to equity and fairness and justice, right? Because this is a justice issue. So again, I want to say thank you so much on behalf of our team at Borough Hall and everyone that was involved in this for 2 years in the making. We love you and we appreciate you and we encourage you to keep going. All of my birth workers, all of my doulas and midwives, lactation consults, all of my consultants, just take advantage of this moment and know that your work is appreciated. And we will not give up and we will never stop trying. And I cannot wait for the day when we open the Bronx Birthing Center. It is coming, ladies and gentlemen. It's coming. Stay tuned. Thank you so much for being here. Gracias a todos. And now I'll turn it back over to our wonderful and amazing leader, Myla Flores. Gracias.
Thank you so much. Bronx Borough President Vanessa Gibson, those are some powerful words, and what I would love to lift up amongst them is, again, the people who are standing with us today, the people who are doing work in whatever lane you're in, and I know right now the next person up who I have the privilege to introduce is also doing such wonderful work, living the journey of parenting right now, Deputy Borough President Janet Peguero. She has stood by us since the beginning, yes. Being a part and in community with other doulas and birth workers before she became Deputy Borough President, has always been watching and lifting up and co-elevating the work that's been happening. And now, having gone through an experience of parenting, pregnancy and parenting, and coming to our launch last year, I thank you for doing the work and staying committed and moving with your heart in such a time that it can be really difficult and we can lose hope because it's so hard and it's so much work. But there are people like us and like you who keep pushing forward. I'll hold this for you.
Thank you. In community, as always, Myla, thank you so much. I'll be remiss if I don't share that this is such a personal initiative and time for me. You want to say a few words before? Dada, your favorite word, Dada? I want to thank the borough president for acknowledging the Bronx dads. Thank you, borough president. I don't think our Bronx fathers get enough credit. Bruce, my husband, and the fathers that are in the audience today, thank you so much for the work that you do, for being a voice when we feel voiceless during such a vulnerable moment. Are you holding the mic, Mama?
We're going to hold it
Okay,
together.
we're gonna hold it together. Again, it is an honor to join you all this morning at the Marion Reproductive Health and Wellness Clinic. Thank you for being a home to me while I was going through this process and holding my hand through it as well, Myla. I just want to thank you. I want to thank everyone for being here, for being present. As I mentioned, this issue is personal for me in many ways. I couldn't have fully understood before becoming a mother myself. As a first-time mom, navigating pregnancy, childbirth, and early motherhood has been both beautiful and transformative. I've learned firsthand, this is, we're learning together, learning and growing. I've learned firsthand the importance of informed choices, the significance of a support system, and the power of having diverse care options, such as doula support that I had during my birthing journey. I'm proud to breastfeed my babies still to this day and have embraced this new chapter in my life. It is a privilege to experience this journey, and it's given me a deeper commitment to ensuring that all birthing people, especially our moms here in the Bronx, have access to the same level of care and support and resources. As the first female-led borough president's office, it has been more important for us to advocate for the rights of all birthing persons and their families. Let's call it what it is, a crisis. A crisis that disproportionately impacted Black and Latina women. This fight is not just a policy issue, it's a human rights issue. And the color of your skin continues to determine your health outcomes. Today's rally and launch brings together the heart and soul of this fight. Community members. You can't have that, you can't eat that. Maternity health experts, midwives, doulas, and elected officials and advocates. Today's rally, I am proud to be standing alongside so many of you who have been tireless in your efforts towards birth equity. The release of our birthing center marks a critical next step in the fight for change. A birthing center that acknowledges the cultural, emotional, and medical needs of every birthing person, especially Black and Latina women who are at the greatest risk. The work we're doing today is not just about policy changes. It's about making real, lasting change in the lives of our mothers, our families, and our communities. We are proud to support and advocate for the work being done here at Merriam, a facility that has been a part of the ongoing effort to meet people where they are, and to ensure that Bronx families have access to education and resources that they need. Let me tell you a personal story. When I was at the last leg of my pregnancy journey, and the mothers know the last week, it's really tough, for lack of a better term. I was encouraged by Myla to come over and receive acupuncture services. If it wasn't for this clinic, I would have had to travel to Manhattan and/or Brooklyn to receive those services. And as a mom that was going through so many changes for the very first time, I felt comforted in knowing that I can receive these services in my own home in the Bronx. And so we will continue to sound the alarm on the maternal health crises, and we will not rest until all Bronx residents are given the care, respect, and dignity that they deserve. Let's keep fighting for the health and well-being of every birthing person in the Bronx, and I hope that this report encourages a conversation, not friction, but that it unites us in our common goal and our mission, which is saving lives. Thank you all for being here and being present today. Thank you.
Yes, I am so in love with motherhood, just at the forefront and integrated into our worlds. I could say so much about that. So next up is this order here.
There you go. Yeah.
Jennifer Dorn, Director of Midwifery at Childbearing Center of Morris Heights. I want to shout out to the work that Morris Heights has done one of the best birth centers that existed in this city. Many people I know had the privilege of getting to birth there. It was heart-wrenching to know it closed down with so many birth centers that our city used to have access to. And so we need to not focus on profit over access to quality care, because birth can be so straightforward, like breathing and digesting, and our bodies are like so amazing at what it knows how to do. Sometimes, because it's not profitable, it gets put down in priority. But guess what? This is a high priority. So to know that we are now working to not just open, thankfully, the Bronx-based birth center that we seek to open, but this intends to be a movement to have more access to childbearing centers like Morris Heights, like in Brooklyn with Haven Midwifery, like Buffalo Birth Center and Love Child. All of these initiatives, they deserve to be known about. Of our 24 members of the New York State Birth Center Association, 8 identify as developing birth centers. 8 are in progress. And so I feel privileged that some people are paying attention to what we're doing, but we really truly also need to lift up the work of so many others. And so in the honor of lifting up the work, Jennifer Dorn, please come forward, and thank you so much for being here.
Thank you, thank you.
We appreciate it.
This is a long gestation. We're not quite at the birth yet,
Yep.
but we're getting much closer. Maternal health is a human right. Maternal health is a human right. That means that every woman and her family globally should have the security and the reassurance that she will be safe and protected during her pregnancy, birth, and raising her child, and that child will be born healthy. That's a human right. But that's a human right that's not respected around the world. And it's certainly not respected within our racialized healthcare and maternal healthcare system within the United States. When I was first hired to come to the South Bronx to open a birthing center with Morris Heights Healthcare Center, it was the first birthing center that was in a city to serve women of color, to serve Black women, to serve Latino women when we opened our doors. The first one. And what did we do over the 26 years in this midwifery run and community-based healthcare center? We had healthy women and healthy babies. Women, our doors were always open for people to come in just to say hi, show us what was happening. I remember one woman, Zakiya Majin, who became one of the spokespeople for our birthing center, walking in the first day and said, "I am home. I feel like a queen." And she had been rejected at 4 hospitals in New York because she was told she was going to be high risk, because she was a Black woman who was 40 years old having her first baby. And Shaka Musa was born very, very healthy 30 weeks later. So it really needs the attention of skilled midwives, doulas, healthcare workers, and surrounding availability of doctors. I've worked in many countries where there was no hospital to go to. So we are a team, but it should start here in the community and be run by the community. So this is a really great moment. I'm really honored to get to be here and to acknowledge your work and your commitment. 2 days ago was International Women's Day, and I thought, well, this is really the way to celebrate our power and our ability. I've spent the last 20 years working in global South countries, mostly African-based, with midwives to improve maternal health care, and here I am right back at the Bronx, where I should be. So on we go to victory in this, to really making the human right for maternal health care become real again in the Bronx. Thank you.
Thank you.
Thank you, Doctor.
Thank you. Next up, we have Bruce McIntyre. Bruce McIntyre is a dear friend now, and we've had the privilege of working together in this initiative, and I honor his work and I celebrate progress with you, Bruce, and acknowledge the work ahead, and knowing that it takes so much strength to be here and do this every day. So thank you for your work. And here,
Peace, everyone.
yes.
My name is Bruce McIntyre III. I'm the founder of the Save Rose Foundation, partner to Miriam. I'm also a focal point of the Emmy-nominated film on Hulu, Aftershock. I also sit on the New York City Council Maternal Health Steering Committee with Adrienne Adams, and I am also on the board for Wildflower Charter School. It's been definitely a full circle moment. This work is very personal to us. I lost my partner due to medical negligence throughout her entire pregnancy back in April of 2020, and have started this work nonstop, tirelessly since then. So it's truly a full circle moment for me. This is something that I truly hold near and dear to my heart. Something that I'm very passionate about, and I'm very grateful for the community that supported me through my time in grief. The midwives, the doulas, the OBGYNs who cared for me, who educated me on maternal health so I can properly come out here and fight for what I believe in. And that's creating better birthing outcomes for Black and brown women. And yeah, it's been a long journey, having to navigate grief, navigate parenting, navigating on how to create and sustain better birthing outcomes and options for Black and brown mothers. Truly grateful for Bronx Borough President and her tireless work in supporting us. Mila and I got our bill for the birthing center bills, for the freestanding birth center bill. We got that passed at the end of 2021. And we've been waiting on these regulations to come through. Yes. So this is a step closer for us to bring our dreams to fruition, and create a space where Black, brown, and indigenous women are being prioritized and no longer seen as an afterthought. So this is, truly this is a revolutionary moment for us, and moving forward as a community, moving forward as a society. Being able to, me as a man, show up for women, and women show up for me as a man, just like God intended it to be. This is how it should be. We should be helping one another, because this isn't just impacting women. This is impacting fathers and men too. So we need to do everything in our part to step up to make sure that we're supporting Black and brown women. But I truly believe in this initiative. I believe that we are going to save lives. We're already saving millions of lives. And, we're ready to bring a birthing center to the Bronx. We're ready to change this epidemic for Black maternal health, and we're ready to change our narrative. And by bringing a birthing center to the Bronx, we're one step closer to doing so. So thank you for all of your incredible support. We're almost there. We're going to push through and make sure that we create something that's going to sustain and value the lives of Black and brown indigenous women. Because if we cannot tailor to the needs of Black, brown, and indigenous women, then we simply cannot create a better maternal health care system for all. Thank you.
Thank you.
Great job, Bruce.
Thank you, Bruce.
Yes.
All true statements. Thank you. So next up we have Brittany Russell, who has dedicated her artistry. When we talk about the midwives, the doulas, let's talk about the artists. Let's talk about the individuals, the community members who are willing to tell a story and to tell other people's stories. And the film itself, it is, I will be happy to allow you to talk about this amazing film. I'm so glad that what I know it's about is it's uplifting families here in the Bronx. Come on forward, my dear. So your dedication and this powerful film has so much opportunity to continue making the change that we seek to have. So I appreciate your work. We all appreciate Brittany Russell. Thank you.
Thank you, everyone. Good morning.
Good morning.
I'm Brittany Russell. I am the director of the documentary You Are Not Alone that sheds light on the maternal health crisis in the Bronx. And before I go any further, I would like to acknowledge the Bronx Borough President, Vanessa Gibson, who has been doing this work before I was doing the documentary. And she had said a very powerful quote, and I want everyone to acknowledge it, is that the Bronx will no longer be the first in everything bad and the last in everything good.
That's right.
And I do believe that this process right here is a testament to that. And I thank you. Thank you to Mila. Thank you to Bruce, who I've met throughout my process as well. And for the community that is being built in the Bronx, you know, this borough gives a lot to everyone culturally. And now it's time that the world give back to the Bronx. I truly believe that. My film starts out with highlighting the beauty of this borough. You know, we have so much to give. It is beautiful. It is home to many, many artists, many creatives. And, you know, without community in the Bronx, I don't think New York or the world would be what it is. I'll say that boldly. We gave you hip hop, we give you so much. And on a personal note, you know, being born and raised in this borough, I've seen it change. I've seen it continue to change, and we should not be left out of the change. And this institution, this moment, is very pivotal for the Bronx. My film highlights the stories of 4 mothers, doulas, healthcare advocates, Vanessa Gibson, and it just shows the why. Why is the Bronx facing so much right now? Why do we have the highest asthma rates? Why is the transportation the way it is? Just the why. And these women share their why, you know, medical negligence. The doctors, you know, forcing what they want in the birthing room against what the mother's wishes are. And it is a privilege to be an artist, to have these mothers open their journey with me and to share their testament. And I also want to thank Bruce, because when I did start this documentary, he was the first one to reach out and tell me what it was like to be a father and also a man that has lost a dear partner. And Bruce, I stand beside you. And thank you so much for all the work that you continue to do for this borough, seen and unseen. Mila, thank you so much for your tireless efforts. I've been following you and watching you, and your dedication to this borough is far none. You are truly a blessing to this borough, and this is only phase 1. Right? And it's such a privilege to be just a piece of this puzzle as an artist, and especially in these times that we're going through as a country, I think that we need to stand together and recognize what's going on and how community will always be there for Black women, for women of color, for Indigenous women of this borough. So thank you.
Thank you. Great job. Good work.
Yes, thank you so much for being a part of this community. And I want to lift up that phrase she said about being a part of the puzzle. And I want to really have us call into our own hearts and figure out what is our part in this puzzle, because we are all part of the solution. And whether it's building the awareness, whether it's having a conversation, whether it's hosting something that elevates some work that's happening in your community, whatever it is, we thank you because you are also a part of the solution. And so I want to take this time to appreciate, you're the final speaker, right? I really appreciate the fact that we are able to host this event launching this report, because it could have been launched anywhere, but I felt very excited that this is a representation of the growth towards a birth center. And so with that, I really thank everyone who's come, and I hope we can also somehow get a group picture. And I'm going to hand it back to Borough President to close us off.
Oh, thank you.
Thank you.
Thank you again, Mila, and you are truly a source of strength and encouragement for so many women in the Bronx, and I want to say thank you. When I first met you and learned about your story and learned about your efforts, I was excited. When we rolled out the Womb Bus, which is still around, it's pink, and it travels all around the borough, I was excited about that because I said many of our clients don't always feel safe coming to us. Right? Transportation is an issue, cost is an issue, but the Womb Bus travels, and we roll up in parks and playgrounds and in open spaces, right, during the spring and summer season, and that was the beginning. And I feel like this Birthing Report was born from so much resilience and strength of everyone, right? Of all of our advocates and healthcare providers and professionals that are dedicated to this work every day. And so while we close today's press conference and the announcement of the release of our birthing report, we are never closing the door on our commitment. And we are now more determined than ever to push this conversation forward, certainly in light of the climate in which we're working in, when we're seeing a lot of attacks on the healthcare system, when it comes to equity and fairness and justice and access. I think it's even more important now for us to align together and to stand together, because our clients, our patients, our mothers, our birthing individuals, they need our leadership like never before. So when we say Bronx mothers cannot wait, we need birth justice now. 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 So thank you so much, everyone, for being here. And again, to Myla, to Dr. Carla Williams, who I want to recognize as well, to Bruce, and to everyone, we say thank you. And let's continue this work. Let's keep pushing forward while we represent the Boogie Down Bronx here. I know that many of you are doing work throughout the city of New York, so I want to acknowledge that. And then finally, I want to say thank you to Morris Heights Health Center. You all have been phenomenal in this work. The first childbearing center that opened in the city of New York was in Morris Heights, and I want to say thank you for pushing forward. We just got money from Governor Kathy Hochul for our women's pavilion, so I want to acknowledge that and say thank you, Morris Heights, for all the work you do, to the health department and to everyone, to the entire team. Thank you, and let's keep fighting for birth justice now. Yes. Thank you so much, everyone.